Good afternoon. This is Dr. Pumipon again, and today is September 5th, 2010. I had a pleasure of meeting Rino and Richie today again. I just want to tell you that today we have done some blood tests and some cardiac MRI, which basically is the special images of his heart to assess his heart functions. So basically today we found that his valve leaking is still a lot as expected. His heart function on the right side is slightly less than normal regarding to his valve leakage. Also his left-sided function is also a little low on the low side of the normal. Today we all have the blood test done, which show some mildly affected in his liver functions, which resulting from his leakage of the right-sided valve in the heart. So from everything that we have done today, I think he still have a significant problem in his heart. I am sure that this will be better, his heart function will be better if we have repair of his valve in the near time. I just want to explain again about the abnormality in his heart. This is the model of the heart. I'm going to remove the shell of the heart out. Over here you can see that the heart has 4 chambers, which is 2 upper chambers, one on the right side, one on the left side, 2 lower chambers, one on the right side, and one on the left side. The blood that coming from the body will flow back to the right upper chamber over here. In normal person, the blood from the right upper chamber can flow to the valve over here, to the right lower chambers over here. You can see that the right lower chamber has some muscles, so it's function as a pump. So it squeezes. When the heart squeezes, the valve over here is supposed to close, and most of the blood in the right side of the chamber will go up and go into these blue color vessels and send the blood going to the lungs. All the blood supposed to go to the lungs and have oxygen mixed up and turn to the red blood. And the red blood's coming back to the left-sided upper chamber over here. And again, the blood flow to the valve, to the lower left-sided chambers. Okay, and when the left-sided chamber is squeezing, this valve is closed, and all the blood in the left-sided chamber is going to these red color vessels and going to the body. This is how the normal circulation should be. For Rino, he has a problem with the valve on the right side here, which is the valve that sits between the right upper chambers and right lower chambers. This is called tricuspid valve. This valve has 3 basically what we call leaflet. There's 3 pieces of valve that close together and open together. He was born with the malformation called Epstein anomaly. Basically what that means is this valve is not formed properly. With Epstein anomaly, this valve is displaced downward into the right-sided pumping chambers. So it moved, supposed to sit here, it moved downward to here. And the leaflet or the valve is not closed properly because of the malformation of the valve. So every time when the right heart is squeezing, his valve is not closed properly. So most of the blood, or even 80% of the blood, supposed to go from right-sided to the blue vessel, it's go back to the right upper chambers. So it caused some congestion in the right upper chambers and caused the right upper chamber to enlarge and bigger because of most of the blood going backwards. And this can create circulation problems because the heart works but it's not effective. So less blood going out of the heart and more blood is going backwards. The way to deal with this is to repair the valve if it's repairable. From the study that we have done today, it showed that the right-sided heart has a little high pressure that affected his liver functions. Again, and this is the problems that has been going on for 10 years. At this point, I am thinking that he should have the valve repair soon. The option for the treatments for Reno is surgical treatment. The surgical treatment can be done either, the first thing is to do the repair of the valve. The surgeon can fix the valve by try to make the valve work as close as normal the way it works. They can readjust the valve position. They can make the valve open and close as normal ways the valve working. That's called a valve repair. Another way is called valve replacement. The second time, in his case, if the valve is not repairable, the surgeon has to take his own valve out and put an artificial valve in that position. This could be done in two ways. One, using the tissue valve, which is basically similar to the human valve, but it can work similar to the human valve. The other way is to use the artificial valve called mechanical valve. These two types of treatment has pros and cons in terms of the adverse effect in long terms, but this is just in general. So either valve repair or valve replacement is the option of treatment in this case.